This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning. So quick medical minute on blood cultures. Obviously not that exciting, but something we do a lot of. And there's a question of whether multi-site, where we traditionally do two sets of blood cultures from two different sites, is better than potentially doing it from a single site. So actually there's not any data that shows that two sites is better than one site. And there's been some authors that have suggested that maybe doing it from one site might be better for a couple of reasons. You can just clean one site really well, and it might actually decrease your chance of contamination rather than having to clean two sites really well. And then you might get better yields if you just have one good site that you get, the most amount of as possible. The kind of one of the things that makes you get better results is getting enough blood. So if you have not enough blood from two sites, it's not as good as having full bottles from one site. So there was a study recently that tried to look at this, and it was one hospital that looked at this, and basically they compared, in 1 year they did the traditional two sites, and then the next year they switched to a single site, and they basically compared over 2 years. And each year they had about 5,000 sets of blood cultures, so a fair amount, and the positive rate, like the true positive, the yield was actually a little better with single site. It was 20% versus 17%. And was the contamination different? No, it was exactly the same. It was 1.6% contamination in either year. So, it's not necessarily enough data to totally change the practice and say that one site is definitely better, but maybe it is. Maybe there'll be more studies. And, for some reason, if we can't get two sites, if someone's a really hard stick or they refuse the second poke, getting from a single site is probably not significantly worse than doing two sites. Questions, comments? All right, thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.